So what is the treatment of stroke in 1970s?
Just aspirin.
IV fluids.
Oh.
And then after that 80s aspirin, 90s, IVTPA, the NINDS trial came positive 1995. And thrombectomy 2016 up to 6 hours. Before 2016, if somebody came with ICA occlusion, MCA occlusion, treatment is aspirin. So in 2016, there are 4 trials that came out. What are the 4 trials? Mr. Clean, the trial name. That was done in Denmark, Netherlands. Second trial is Escape, done in Canada. Third trial, Swift Prime, done in US. Fourth trial, Extend IA, done in Australia. All these 4 randomized multinational trials that were done separately, that showed there is a significant improvement when you do thrombectomy. So I think it's very rare combination at a particular part of the time of the history, 4 different trials showing a same thing, and the stroke management changed overnight. So number needed to treat. How many people you need to treat to prevent 1 stroke for people who are taking aspirin? How many aspirins you have to give to prevent 1 stroke? Just random numbers. What do you think, Jack?
8.
8.
200.
200. 99. 7 or 8. 50. 20.
150.
150. More than 200. More than 250 or 200, in that ballpark. But okay. Now, how many people you need to treat to have good outcome with IVTPA? How many people you have to give TPA to have 1 good outcome?
8.
8. Okay, good. So again, it depends on when you are giving TPA. If you are giving TPA within 1 hour, the outcome is good, right? You need to give like for 4 people. Again, if you are delaying giving treatment 2 hours, 3 hours, it jumps immediately to 8 and 12. After 3 hours, it would be like big number. So time is brain. Okay, now tell me how many people you need to do thrombectomy to have good outcome? Less than 6 hours. If some people come with a ICA occlusion right side, with a big stroke scale, how many people you need to treat?
3.
Wow. Means it's such a powerful treatment. The answer is 4, 3 to 4. Yeah. So that is people who are coming. You should become a stroke neurologist. Yeah.
Like good guessing skills.
Yes, good guessing skills. This is people who are coming with less than 6 hours time frame. If somebody is coming more than 6 hours or 6 to 24 hours, those 2 trials are Dawn and Diffuse 3. Those came in 2018, this year. I mean, Dawn came last year, last year. But how many people you need to treat if somebody is less than 24 hours? I mean, 6 to 24 hours. Any good guesses? 100? 10? 20?
15.
15? Yes.
Oh, I don't know.
Okay, good. Because you are in a winning streak, so I don't. It's very tough this answer to guess, So it's 2. The reason is these extended window trials, they did MRI, and usually you don't do MRI, right, to give TPA. For getting MRI, it takes 1 hour. You have to screen, there are no bullets, no, and then you do MRI. But these, out of 6 hours, in Dawn trial, I am part of the Dawn trial, we used to do diffusion weighted imaging, diffusion perfusion mismatch. How much brain tissue is dead? How much brain tissue is living? So based on that, we used to do this MRI brain with rapid software. The software gives, there is a core dead tissue 10 cc. The penumbra is 100 cc. So previously it's just like time, when is the last known normal? Time-based approach. Now it changed to tissue-based approach by doing scan. So that's why its number needed to treat is 2 to 3 between 6 and 24 hours, because we are doing MRI and perfusion-based techniques. Okay, so that is the acute treatment of the stroke, acute stroke treatment.